Pete Holloway. I'm a senior vice president with Hazlett, Bird and Watson in Wheeling, where I'm a financial advisor, and I'm also a certified financial planner. And as always, it's my great pleasure to welcome you to On Money. Today, we've got a guy who's right in the center of the storm, Doug Harrison, who's the CEO and president of both Wheeling Hospital and Reynolds Hospital, will be our guest today. We were not going to be talking about medical advice, but principally about some of the things that are going on with the hospital financially. Doug has a BS in business from West Virginia University and an MBA from Winsburg. He was 20 years with UPMC before he came to Wheeling, and he has 2 daughters. And I want to thank you very much for agreeing to be with us, especially I'm sure your desk is probably stacked 3 feet high with paper and so forth. So thank you for joining us.
My pleasure.
Okay, so you step into a new job as the head of a hospital, and COVID, which nobody saw coming and certainly took no classes in, arrived. How did you handle things, and how did the hospital take care of this totally unexpected event?
Well, it has been a challenge, and actually we are probably, as I speak right now, we're in the worst of it. Even the surges before this current surge is really taking its toll. The difference between the surges in the past and what's happening now are the loss of staff. So we have had tremendous turnover in staffing, and actually we are in a nursing crisis right now, not only at Wheeling Hospital, Reynolds Hospital, but across our system. It is our #1 priority in how we get nurses back to the bedside to be able to care for patients. It is truly the rate limiting factor right now in how we care for patients is the staffing issue.
Again, yeah, we're reading about the staffing issue everywhere. How about supply chain problems? Are you seeing, especially with medicines, are you seeing issues with that yet?
We are having some issue getting some of the monoclonal antibodies. There's a nationwide shortage of those, and those have proven to be very effective. In the news today, Governor Jim Justice had contacted COVID, had taken the monoclonal antibodies, and now he's saying how great he feels. So that's a concern for us. We haven't had any concerns on medicine to date. Our protective PPE equipment seems to be okay. Supply chains seem to have rebounded from a mask and a protective gear perspective. And our drug supply right now seems to be unaffected as well. So, that really the monoclonal antibody and the PCR testing for our lab, trying to get the lab supplies in has been somewhat a challenge here lately as well, and that's just because of such demand for these labs.
I understand. I'd like to get back to your staffing issues for 1 second. There have to be a lot of nurses who have retired. Do they have to take tests to come back in, or can they just kind of step into their old roles?
As long as their license is still valid, they can certainly step back in. They have to maintain that on a yearly basis. And as long as those are valid, they can certainly step back in. We did see Wheeling Hospital in particular had numerous nurses. When I got here, it was not uncommon for me to walk the floors and hear and talk to our nurses that had 20 years, 25 years, 30 years experience, which is wonderful. If you're a patient, that's what you want. You want a good seasoned nurse to take care of you. When COVID hit and the staffing crunches, we did see a lot of those seasoned nurses take retirement and step out. And so, now you're left with newer nurses, graduate nurses that are just coming, out of programs. And the issue there also is, if you look around our region at the nursing schools, the graduation rates have not been that stellar. They're finding trouble hiring faculty, as well. So they're having to limit the size of classes of nurses. So this is going to be a supply chain issue for not only the state of West Virginia, but across the country for many, many years to come. Albert Wright, our CEO, this is his top priority, is how to increase nurses at the bedside. At Wheeling, we recently, Wheeling had not taken, we did not use LPN nurses in the hospital. It was basically an RN hospital for many years. We've now expanded just because of the crisis, where we're now taking LPN nurses at the bedside. Now they're a little limited in what scope of duty that they can perform, but it helps to increase our ratios for nursing care and try to offload what's happening in our emergency rooms and trying to get patients up to the floors that need to be admitted.
Now, as we all know, WVU, you're working with WVU, as is Reynolds. How has that strengthened the hospital, both financially and medically?
Oh, the impact has been very, very significant. So I'll speak to Reynolds, first. Reynolds came into the system in 2016 and was on the verge of closing. The services offered there were not great. And now, if you look at Reynolds this year, they're going to end up with a surplus, probably close to $9 million, which has been an absolute wonderful turnaround. Staffing has doubled, more than doubled at Reynolds, and the medical staff has grown significantly at Reynolds as well. So the turnaround there has been phenomenal. Wheeling we just joined the system in April, but we are already seeing the financial impact from joining the system through our supply chain, our group purchasing organization. Our payer contracts are significantly enhanced at Wheeling because of joining the system. And what it's done for us is, from a recruitment standpoint, we've had just tremendous success in recruiting physicians to come to Wheeling Hospital. And they like the fact that they're able to be a part of the academic medical center, that there's a tie back to an academic medical center where they can be an adjunct faculty member. They can have some academic time built into their contract and have that close relationship back to the Morgantown team. So it has been a tremendous success from that aspect. So from a medical growth perspective, adding new services and the financial impact, it's been a great success for both hospitals.
As a local resident, that's nice to hear.
Yes.
So now obviously in my profession, I'm a devout capitalist. And so I love competition. And within the region, we have UPMC, Cleveland Clinic, Ohio State University Hospital, et cetera. Does that keep you on your toes more, or is it a good thing or bad thing? And it's hard to talk about outcomes. Will everybody survive, or will there be mergers, or can you even speculate on that?
Well, in the state of West Virginia, we are a certificate of need state, and that has certainly benefited this state, in my opinion. I worked for UPMC for a number of years, and Cleveland Clinic is no different. Those are extremely large health systems, and very, very profitable, in what they do. UPMC is a $24 billion global enterprise. And so, if you look at what WVU has built, if you go back before the creation of the West Virginia University Health System, you look at what was happening in the state of West Virginia, you had a lot of for-profit companies coming into the state of West Virginia, and at that time gobbling up these small hospitals. They would prey on small rural community hospitals. They would strip out every dollar that they could get out of that hospital and ship it back to, at the time it was HCA out of Tennessee. And so the state of West Virginia said, whoa, we've got to kind of stop this. So there was actually legislators put together the formation of the West Virginia, at that time it was called West Virginia United Health System. And they said, we want to protect healthcare in the state of West Virginia as a local entity. And so the creation of that health system was formed. At first, it was United Hospital out of Clarksburg and Ruby out of Morgantown. If you look at what that has grown into now, we are nearly between owned hospitals or full hospitals within the system and managed hospitals. I think we're up to 22 hospitals now in WVU medicine. And what that has done is it has preserved local healthcare, and it has preserved the local dollar. So, for instance, Medicaid is a state-run program. It's basically a pass-through type of program. The government, federal government says, here's your Medicaid dollars, state, you figure out how to best spend that dollar. If you look at through the years and you look at health outcomes in the state of West Virginia, we have consistently ranked 45th to 50th in almost every outcome. Not good, not a good showing for West Virginia health. And so what WVU medicine is on the path to do is, how do we start to change that narrative? How do you start to impact local healthcare? And it's a generational change. It's not going to happen overnight, but you've got to have services and offerings for people at a local level. So our Medicaid dollar in the state of West Virginia years ago was being spent in Pittsburgh, it was being spent in Columbus, it was being spent in Cleveland, you name it, it was going outside the state. And I can tell you, having worked in Pittsburgh, that Pittsburgh hospitals got paid more from West Virginia Medicaid than West Virginia Medicaid was paying West Virginia hospitals. That's just wrong. And so I think with the creation and the growth of WVU medicine, you know, we've always said, if you look at the future of healthcare, you know, and the way that you mentioned mergers and acquisitions are happening, you know, each state, and this came from the Advisory Board Council, which is a national organization that we actually use that helps guide healthcare. The advisory board came out with a statement a couple of years ago that said each state may have, by the time all of this is said and done, 3 to 4 viable healthcare entities per state. Well, West Virginia being the size of that we are, do you think we're going to have 3 to 4 viable healthcare organizations in the state? Probably not, but we at least need to have 1 or 2 very healthy, viable options. Otherwise, all of those dollars get shipped out of the state. And so we are on a journey to make sure that that the healthcare remains at a local level, and that we do our part in attracting physicians that want to come here. When I first started at WVU, you know, Albert and I would go out and talk to doctors about coming to West Virginia, and the typical response was, where's West Virginia? And why do I want to go there? And now, if you look at the core faculty at Morgantown, when I started, there were roughly 400 core faculty on the Morgantown campus. Now they're up over 1,000. You know, so the growth has just been phenomenal, absolutely phenomenal, and that is since 2015.
Well, that's I did not realize all that, and that's really interesting to hear. I want to change subjects just a little bit. Of course, COVID is the main focus of all health right now, but I want to talk about the drug problem in West Virginia a little bit, because it's holding us back. West Virginia, unfortunately, has the lowest labor participation rate in the country, and a lot of that can be attributed to drugs. What is the hospital doing, or are you able to do things to ease that crisis?
It is it's an issue, you know, a severe issue. It affects our ER rooms on every single day. It affects local police force and how they deal with folks. So, what we did as a system at a local level, when OVMC closed down, which was the typical behavioral health type of hospital in the Valley, Reynolds Memorial opened a 24-bed inpatient psychiatric unit to help with those psychiatric needs. So Wheeling and Reynolds work very closely together to make sure that patients receive the inpatient psychiatric care that they need. I have a goal now to work with the system to expand outpatient-based needs, because that really is, how do you get team-based care? How do you get folks into programs that are going to help them? And so one of my goals on a 3-year strategic plan is to increase, and it starts with recruitment and education and training. How do we increase the outpatient footprint of what we're dealing with? And so we should have a site in New Martinsville. We should have a site in Moundsville. We should have a site in Wheeling to address outpatient needs. The other thing that we are doing at Wheeling, since we don't have an inpatient psych unit, we've increased the number of social workers at the hospital that help when these folks present. We help try to get them connected with local resources. So one of those local resources, Catholic Charities, has some programs available for folks. And then we try our best to get people the help that they need at a local level. The bigger issue is around adolescent psych. And we're seeing more and more adolescents present with suicidal ideations, with just drug problems. And so the behavioral health component on the adolescent piece is very, very troubling. And because there's so few adolescent sites in the state of West Virginia, and you can't cross state lines. You have to, these folks, if they're on a Medicaid product, which most of them are on a CHIP program, a child's health insurance program, they have to stay in the state. And so we're shipping kids, and first of all, they're coming into our ER, they're sitting three days to a week, sometimes a week and a half in an ER room before we can place these kids. And they have to be on watch. So we have to have a guard sitting there watching these folks, try to get them. And a lot of times, from Wheeling to Bluefield or to Huntington, we're taking these kids out of their homes and trying to get them the help they need, but they're leaving the market. And so it's an issue. And we understand that from a system perspective. We are trying to put resources at a system level to address the behavioral health needs. We're trying to expand the behavioral health program at Morgantown. I'm looking to expand the program here in the Northern Panhandle to try to address these needs. But it certainly, we feel the pinch of it every single day.
Anything else on your plate?
Yeah.
Let's leave it at that. I really appreciate what you brought up today, because a lot of it, I try to keep my eyes on the news, and a lot of it I just haven't thought through. Keep up your good work. We'll probably have you back in 6 months or so. Hopefully things will be a lot easier for you, and I hope you get some vacation time too. I want to thank you very much. And I want to thank the audience. We'll be seeing you next week. I'm Pete Holloway for Hazlett, Bird & Watson.